Today I got to speak to a board-certified dermatologist and medical director for Zion Health, Christina Han. We went over common hair loss, common practices to treat hair loss, and some myths and some things that are true about hair loss that we can do to hopefully help you guys on your hair growth journey. Most of you guys might know me from my socials with my crazy hair transformation, where we've seen some great results over the last 9 months, from being bald over the last 3 years to having a lot more hair on my head, feeling a lot better about myself. So hopefully you find this information very helpful. It is my first YouTube video related to hair content and helping you guys out. As well, if you guys can hit that subscribe button, I would greatly appreciate it, as we're on the road to 100,000 subscribers, trying to get our YouTube plaque. And with that being said, enjoy the video.
Hi everyone, I'm Dr. Christina Han. I'm a board certified dermatologist in Canada and the US, and I also work as the medical director at Zion Health in Vancouver.
Sweet, Dr. Han. Basically, I just want to go over some questions today, break down some myths, some truths, hair losses, and things that people can do to treat hair loss in itself. What are common hair losses? And kind of a two-part question is, what can they do to treat these common hair losses? The first one's probably the most common, is androgenic alopecia. So like, what is it and what are the most common ways to treat it?
Great question. So androgenic alopecia refers to male or actually also female pattern hair loss. It is the genetic progressive hair loss that we see and coin as male pattern and female pattern hair loss. So this is a genetically driven process where the follicles undergo miniaturization to the point where the follicles get so small that the hairs are essentially invisible. And so you see the ongoing loss mostly in men on the front, and then the vertex, and then the two areas eventually meet. And the most common ways to treat it, first of all, would be to use either minoxidil, finasteride, and in some cases even dutasteride. Those are the most common treatments. From a medical perspective. From a surgical perspective, of course, there is hair transplantation as well. And as a dermatologist, pharmaceutical treatments and medications that are either over the counter or prescription are what we commonly use for our patients.
Is traction alopecia?
Traction alopecia is essentially where people can get hair loss as a result of traction or excessive pulling of the hairs on the follicle. So the most common examples would be excessively tight ponytails, buns, braids, dreadlocks, that type of thing. And unfortunately, over time, it can actually cause scarring hair loss. So you can actually permanently scar those follicles and result in no chance of regenerating that hair. And obviously, to treat it, you just try not to do really tight hairstyles.
All right, this one's hard for me to say, but telogen effluvium.
Telogen effluvium. So telogen effluvium is essentially stress or medication-induced hair loss. So telogen hairs are essentially the resting hairs, and so those are the hairs that all fall out. It's usually fairly sudden in onset and can occur as a result of any stress on the body. So it could be medical stress, psychological stress, nutritional deficiencies, medications. Postpartum hair loss after delivering a baby in women is also a form of telogen effluvium. So that's where all the resting hairs fall out. It's usually temporary, so that's a good thing, meaning that it often stops over time, but it can be very alarming for people because it can happen rapidly and is often a delayed onset of a few months after the stressor. So people sometimes don't attribute it to the obvious cause. And treatments will depend on what's the cause of it. Obviously, making sure that any underlying medical issues are addressed, time, and making sure that you're well balanced nutritionally. And stress management is obviously part of it too, but that's sometimes easier said than done.
Yeah. What would you say is like the main connection between stress and hair loss? Like, what's like the hormonal imbalance that might cause hair loss from stress?
Yeah, that's a really good question. I mean, I think there's a lot of evidence trying to suss this out. Certainly cortisol, which is a stress hormone that our body produces, is one of the contributing hormones, but that's often not the be all and end all for the only hormone that causes hair loss. It's probably not fully understood. But certainly psychological stress can promote and even trigger hair loss. A common one I see in clinical practice is actually also alopecia areata, which is that hair loss that is patchy with the bald spots. That's quite common as well. And that's also thought to be due to stress. But even clinicians and researchers aren't fully aware of exactly the hormonal triggers involved.
So with alopecia areata, is it something that they can get that hair back over time? Like it's depending on how long it is, it's more of like a temporary loss?
Yeah, the good news is that oftentimes it's very readily treatable. It does often require medical treatment. So it's not usually treated with things like finasteride or minoxidil, but is often treated with injections with an anti-inflammatory into the scalp. So it's often a good prognosis, depending on, as you say, the extent and duration of hair loss. But yeah, that one definitely usually does have a good prognosis.
Sweet. Is there any other common hair losses that people might go through that I didn't mention that you might be aware of that I'm not?
I mean, I don't think there's any real common ones other than the ones that we've mentioned, but certainly scarring hair losses overall are an umbrella term for different types of hair loss that cause scarring into the hair follicles. And those will often require a consultation with a dermatologist or your physician in order to delineate the actual causes. Certainly things like lupus, rare conditions like lichen planus can also cause a scarring hair loss, and those will definitely require different types of treatment.
Kind of a personal question for me. Isn't there ways to tell different types of hair fall based off like doing like a pull test? Like if you're DHT sensitive, obviously like you're going to have like scalp hair fall. If you're having like hair fall from the sides, would that be something else? Is there different ways to like kind of tell?
That's a really good question. There is no specific way to tell just based on the hair pull test, but certainly DHT sensitive zones of the scalp are really more limited to the areas that men experience male pattern hair loss. So the sides would be quite unusual just because that is not a DHT sensitive zone of the scalp. If there's a positive hair pull test, meaning you tug on the hairs and there's a lot of hairs falling out, that does tend to push towards a telogen hair loss, meaning that telogen effluvium or stress-induced hair loss. But certainly the best practice is always to see your doctor to really assess what type of hair loss, because it is a clinical picture based on the exam, potentially some investigations as well.
I've seen people talk about higher test levels on finasteride when people see side effects that would say that their test is getting reduced by reducing the DHT. What are your thoughts on finasteride actually helping testosterone or ruining your testosterone?
So, I think there's a topic that a lot of men and even physicians don't know about, which is, in women, we have menopause, and menopause is a decline in estrogen over time. And in men, that certainly can happen as well as men age. But it's not a well versed topic when it comes to testosterone testing in men, unless they're having symptoms of low testosterone, as it is in, for example, women. And certainly that extends into the hair loss space, where testosterone, DHT, is not routinely done as the standard of care when it looks at hair loss and androgenetic alopecia specifically. Simply because we don't have good correlations on serum or blood levels of testosterone and DHT as a clinically relevant measure for a given person's hair loss. That's a very complicated way of saying essentially it's not in the standard of care for dermatologists or hair specialists to measure a given person's DHT level, and it's not routinely done. But maybe it should be. I mean, we know that DHT and testosterone are big players in male pattern hair loss. And so you bring up a really interesting potential future area of investigations that could be done in real life clinical practice. But as it stands now, it's not something that's done.
Explain the difference between finasteride, dutasteride, or at least just explain dutasteride for people that don't know?
Sure. So dutasteride is essentially a more quote unquote potent version of finasteride. Finasteride specifically blocks type 2 5-alpha reductase, whereas dutasteride blocks type 1 and 2 5-alpha reductase. Our body has both type 1 and type 2 5-alpha reductase. And so when you're able to block both isoforms of 5-alpha reductase, you essentially could potentially block more of that testosterone being converted to DHT. So dutasteride can be of benefit for people that, for example, fail finasteride or don't get the efficacy that they're looking for and just need a bit of a boost just because of the efficacy targeting both types of 5-alpha reductase. Oh, can I just quickly add as well that dutasteride does also have a longer half-life. So what that means is that dutasteride can act longer, particularly when taken orally, because of its effects having a longer half-life compared to finasteride.
Rosemary oil.
Yeah, rosemary oil. Love it. I think it's one of these things that is in the spotlight right now. And I definitely think it's an adjunct to pharmaceutical treatments when it comes to hair loss. And particularly in androgenetic alopecia, there is some element of natural blockade of DHT. So I think that's where some of the evidence comes from. Now, from a science perspective, there's always going to be less evidence in the evidence-based world on natural ingredients and supplements, but definitely a bit of a mover and shaker right now when it comes to an adjunct therapy for hair loss.
Sweet. Okay, next one for you is your thoughts on microneedling.
Yeah, this is a really common question I get as well. Microneedling has good evidence to stimulate blood flow, also potentially improve collagen production in the anti-aging world. And certainly in the hair loss space, you also increase penetration of the topical being applied. So it all comes down to elements of blood flow improvements as well as wound healing that happens at the microscopic level when you do microneedling. And then third pillar really is delivery of topicals. So I do think that it is, again, a nice adjunct. What's not known is frequency, diameter, depth of needle. All of these have, I think, great anecdotal evidence, but guideline-wise from the medical realm, it's a little bit unknown. But I certainly don't doubt that there is some added benefit for sure when it comes to drug delivery and also from the wound healing perspective as well, and just stimulating blood flow.
Awesome. I agree with you, by the way. I use it, so I think it works. But
yeah, and it's used in other areas of dermatology as well, not just in the hair space too. So yeah.
Your thoughts on scalp massaging to promote hair growth or prevent hair fall?
So this one, I don't know if there's as much evidence, but I do definitely think that scalp massage and massage in general does promote blood flow, likely helps with activating muscles in the area, which also will promote blood flow and delivery of nutrients to the area. And I think massage therapy has lots of benefits in the outside of the hair world space. So I don't think there's any harm to it. Unfortunately, when it comes to hair shedding and hair fall, no matter what you do, whether you brush, massage, shower, all those things aren't going to prevent those hairs from falling out. So I think it's fine and safe to do.
Sweet. Laser light therapy.
Interesting. Yeah, laser light therapy has been something that I actually came across a long time ago when I was training in my dermatology residency when I was in Asia doing an elective. And in Asia, they were doing this more than, I don't want to age myself, 15 years ago. And so it's not new to me at all. And it was used primarily as an adjunctive therapy to all the pharmaceutical treatments that they were doing for hair loss. Again, it's meant to stimulate blood flow and also likely reduce some element of inflammation. In dermatology, we use light to treat different skin disorders. And we do know that visible light, as well as light in the UV area or even in the laser spectrum, all have functions in the skin by even reducing inflammation. And so if there is a low level degree of inflammation in the scalp, then certainly it'll also target that. But I do think a lot of it does benefit the patient because of increasing blood flow.
What are your thoughts on Botox for a hair therapy?
I would have to review the evidence again, but I don't think there's a ton of evidence yet for Botox. But Botox seems to be used for lots of indications. And interestingly, I have had a patient who was doing Botox in the scalp for hyperhidrosis, which is excessive sweating, because he was having a lot of sweating in the scalp. And interestingly, he told me he thinks his hair is thicker. So that's my recent experience with Botox in the scalp. But I don't think it's common practice at this stage in real life clinical world.
Perfect. Yeah, it's more of a come up thing where people have been talking about it recently. Tretinoin, kind of a new one, or retinol for hair loss. People combining it with other things and seeing if they can see some hair growth from it.
Yeah, so tretinoin is something that we use readily in dermatology. It is and has been used in the hair loss space as an adjunct. Tretinoin, as you know, is a retinoic acid or a derivative of vitamin A. And how it works in the skin is that it allows for improved exfoliation of the skin by increasing cell turnover, as well as boosting collagen production. And finally, it also will help to increase penetration of topical agents in the skin. So essentially, I tell my patients it's like a controlled chemical peel a little bit. So patients can experience some level of irritability in the skin, redness, and flaking. So that's where I would say caution needs to be exercised. But yes, it has been formulated in a lot of topicals as an enhancer for penetration. And we know that tretinoin overall is useful in the skin for its ability to promote growth factors and collagen production too.
Your thoughts on PRP?
Yeah.
And what it is and how it works?
So PRP is really popular. It's a procedure that is done in the clinic where basically the patient's blood is extracted, spun down, and then we essentially take out all the plasma-rich platelets, and that contains a lot of the growth factors and nutrients and micronutrients in the blood, and that's redelivered into areas like the scalp to promote the hair follicles from regenerating hairs. It's definitely been helpful for a lot of patients, and patients will utilize it as a non-pharmaceutical and sort of almost natural, because you're essentially taking blood from the patient's own body and the patient's own growth factors and delivering it to where it's sort of needed, which is in this case the scalp. So a lot of patients like it. It's often multi-sessional, meaning they will have to have more than one treatment. It's a bit painful, but I think it's a great adjunct for patients. Again, I don't think it's a replacement for pharmaceutical treatment, and you're not going to necessarily get results in every single individual. So definitely results will vary. But pharmaceutical treatments are still going to be the workhorse when it comes to efficacy in regenerating hair and maintaining the existing hairs as well.
Okay, last one on the list is minoxidil, what it is, how it works, and your thoughts on it.
So minoxidil, as you know, Zeph, is the only Health Canada and FDA approved treatment for hair loss in women. It's also the only one, along with finasteride, for men. It works differently completely than finasteride. It is essentially thought to promote new blood vessels and improve circulation. And it also likely prolongs the anagen or growth phase of that hair follicle. So, so no impacts on DHT or hormones. It was actually used historically as a blood pressure lowering pill. And so that's actually how it got discovered, where these patients that had high blood pressure were put on oral minoxidil, and then they started growing hair. And hence Rogaine was born. It works really well in a lot of patients. It's obviously sometimes the first line for patients because the topical formulation is available over the counter in both Canada and the US. In the oral form as the pill, it is completely off-label, but has been utilized, and I use it in my practice to help people with hair loss, both men and women, and it can be very effective as well. Yeah.
What are some side effects with minoxidil topically that I would prefer taking topically versus oral? Is there more risk of taking minoxidil orally than there is topically?
Yeah, that's a great question. So topical minoxidil is generally really well tolerated. Most people have no side effects at all, but certainly scalp irritation can be one. Also, unwanted hair growth in other parts of the body has been reported with topical, and I sometimes see it in patients where they have excess hair growth on the face, and this is more notable usually in women. Orally, yes, you can increase your risk of side effects, and that's true for all treatments. The pills will always have more than topical, but the most common ones are headache, swelling of the hands and feet. You can also get unwanted hair growth, and then palpitations or lowering of blood pressure can also occur. And so people can sometimes feel a bit dizzy or faint, especially if they already have low blood pressure to start with.